Hi, this is Dr. Amrita, and welcome to the Health Wealth Bridge podcast. Acute otitis media, when the ear aches. Earache is common in growing children. It may be due to wax, acute otitis media, otomycosis, aeroplane ear, or even glue ear. Earache due to acute otitis media is one of the commonest conditions children come to me with. But what exactly is acute otitis media or AOM? Whenever doctor says it's an acute condition, we mean that the duration of the illness is probably less than 3 months or 12 weeks. In case something is more than 12 weeks duration, it often becomes chronic. Acute otitis media is a condition in which the mucosal lining of the middle ear gets inflamed and can cause earache, blocked feeling in the ear, decreased hearing, and even fever. When the inflammation in the middle ear increases, there might be fluid accumulating in the middle ear. This infected fluid causes the eardrum to bulge outside, increasing the severity of pain and is often accompanied by high-grade fever. If the condition is not reviewed by an ENT surgeon, then the eardrum can burst under pressure, giving rise to discharge of mucopurulent debris from the ear. This is often followed by a decrease in earache. When something like this happens, it's called acute suppurative otitis media. This condition is common in children and in the lower socioeconomic conditions often. With increasing age, as a tendency of repeated URI, that is upper respiratory infection, and ear infections decreases, the condition may happen less frequently. In those with allergic sinusitis, allergic rhinitis, the problem may persist even as adults. The eustachian tube in children is shorter and at a lesser angle to the horizontal than that in adults. This causes more secretions to accumulate in the middle ear. That's why children are more at risk of developing this acute otitis media. During breastfeeding in a supine position, there could be regurgitation of milk into the middle ear through the eustachian tube and can aggravate the problem. Mothers who are breastfeeding should ideally sit up with back support, have their hands elevated, a pillow under their knee so that when they are sitting cross-legged or with support under their knee and hand, baby's head is at an angle up from the horizontal. That prevents regurgitation of milk into the middle ear. What you need to know if your child has ear discharge for the first time. You must consult an ENT surgeon for an opinion regarding the tympanic membrane, whether it is infected, whether it's intact, whether you can do something to relieve the pain. After one episode of acute otitis media, if there's a proper course of antibiotics, it will help in healing the eardrum. But in the case of recurrent cold, the same ear may discharge repeatedly. The same happens even with inadequate treatment of the first episode of acute suppurative otitis media. The plan is to stop recurrent cold and upper respiratory tract infection. This can be helped by improving the child's immunity. In the case of a runny nose for more than 5 days, the same problem will recur. Remember, if you have a cold, your child can catch it too. What do you need to do? You have to prevent cold and flu as far as possible. Visit a doctor if cold is for more than 2 days. Avoid breastfeeding in the lying down position and always have the head end elevated while feeding. In case of persistent or recurrent acute otitis media, a full battery of tests may be needed. Why does the mucus discharge occur in otitis media? Your middle ear, the part of the ear behind the eardrum, contains ear ossicles and also is lined by plenty of mucus secreting glands. Otitis, that means ear, media meaning middle, is a condition where there is inflammation of the middle ear. It could be chronic, acute, or another variant called the secretory otitis media. Mucoid discharge from the ear occurs when there is inflammation of the middle ear mucosa associated with a defect in the tympanic membrane. Typically, this condition may be associated with allergic rhinitis. Why does negative intratympanic pressure occur in the stage of tubal occlusion of acute otitis media? The eustachian tube connects your middle ear with the nasopharynx, the part of your throat behind the nose, and this gets blocked during a cold URI due to edema or swelling of the mucous membrane. The mechanism of maintaining air pressure inside the middle ear gets hampered. This causes negative middle ear pressure and indrawing of the tympanic membrane. The negative pressure causes inward bowing of the tympanic membrane and is known as retraction. This can cause pain in the ear. Due to the inflammation in the middle ear mucosa, the cells start secreting more and more fluids. The air in the middle ear gets progressively reduced. But as more and more mucus gets accumulated, the eardrum then starts bulging outward and can cause severe pain. This happens in acute otitis media, and the eardrum looks like a pus-filled balloon that can burst if not appropriately treated. How quickly can a perforated eardrum recover from damage? Traumatic ear perforation can heal by 7 to 10 days, the latest by 3 months. The ear, meanwhile, needs to be dry with appropriate medicines, and you have to prevent water entry strictly. Ear perforation due to chronic otitis media, however, needs surgery. Initially, ear drops may be given for symptomatic relief, but the definitive treatment is definitely ear surgery for chronic otitis media.
Health Wealth Bridge Flash does not provide medical advice and is for informational and educational purposes only and is not a substitute for professional medical advice, treatment or diagnosis. Call your doctor to receive medical advice. If you think you may have a medical emergency, please dial your local emergency response phone number. Thank you.
You were listening to Dr. Amrita on the Health Wealth Rich podcast.